colonoscopy is a test to examine the lining of the last part of your bowel. It's also called the large intestine or the colon. This is done using an endoscope, which is a flexible tube about the thickness of the little finger. It has a camera and light at one end. It is passed through the anus or the back passage and carefully moved around the large bowel by a specially trained doctor or nurse called an endoscopist. For a colonoscopy, you will need to undress and put on a gown. You will be asked to remove any glasses, and a nurse will make you feel comfortable on a couch lying on your left side with your knees bent. For your comfort and reassurance, a trained nurse will stay with you throughout the procedure. If you're having sedation, a nurse will give you oxygen through a face mask and put on a small plastic peg on your finger to monitor your pulse and oxygen levels. The sedation will make you relaxed and drowsy, but it will not put you to sleep. The endoscopist will then gently insert the colonoscope through your back passage into your colon. During the procedure, air is passed into your colon to give a clear view of its lining. Therefore, you may experience some wind-like pains, but they shouldn't last long. In addition to that, you might feel as if you need to go to the toilet. This is a perfectly natural reaction. However, as your bowels will be empty, there is no need to worry. Sometimes it's helpful to take a biopsy, which is a sample of the lining, for which we use a small instrument called biopsy forceps. This is passed through the colonoscope to pinch out a tiny bit of the lining about the size of the pinhead. That sample will be sent to the laboratory for analysis. Many patients wonder if a colonoscopy is painful. You may experience slight cramping as a result of small amounts of air that are pumped in the colon, and the stretching caused by the scope passing inside the colon during the procedure. To prevent the discomfort during the procedure, sedative medications can be given. As an alternative to sedation, you might consider using Intonex, which is a mixture of gas and air delivered through a face mask. The actual time spent on a colonoscopy procedure usually is around 20 to 40 minutes. However, you should allow 2 to 4 hours when coming to have a colonoscopy to include preparation and recovery periods.